Good starting.
No pressure.
No pressure. Even one pill can absorb a lot. So when COVID was going around, they checked to see if charcoal would work on COVID with cows. So they gave the cows COVID through swallowing it, right? And then they gave them charcoal water, and it worked. Okay? The problem is if the COVID is already in the lungs and everything, then of course it doesn't work. But if you have just gotten it in your mouth or nose and it's really early, you could take a charcoal and it would suck it up. So it does that. If you've got food poisoning or your stomach's hurting after you've gone to a restaurant and you wonder if you've got food poisoning, take a charcoal. If stomach flu is going around and you're starting to have an upset stomach, take a charcoal. It really does help. You don't want to take too much because it will cause constipation and bind you up. So you want to be careful how much you take. But also a sore throat. If I have a sore throat and people are complaining about sore throats and I start to get a scratchy throat, I will suck on a charcoal and my sore throat usually goes away. So
also you want to tell them if they're on medication.
Oh yeah, there's certain medications that you cannot use charcoal with because it will absorb the medication as well. Thank you for reminding me of that. So you need to make sure you're not next to your medication. I mean, you need to find out like what medication you're on that's going to affect that, the charcoal. But it does absorb medication. It absorbs good and bad, so you don't want it to absorb your medication that you're relying on to do something. Anyway, these are not sweetened, so they don't taste that great, but they're not bad. No, they're not bad.
They have sweetened ones too?
Oh, they do, but how ridiculous.
The sugar just
So the picture that Wayne, we're going to be showing you how to do a home sauna with what you have at home. But the price, look at the price of that. Saunas are really going down in price, and Wayne and I just got one just like this. Is a double sauna. We paid, I don't know if this is it is a two-person sauna, so the prices are going down more. We paid $230 for our double sauna, and ours had, this one does not, but ours had infrared lights in it. And I don't know if you've looked at the studies recently about infrared, but infrared is so amazing when it's the sunlight you need. But we don't get a lot of sunlight up here in the winter. And so Dr. Schwelt is a doctor out of Loma Linda University, and he had a patient who came in with COVID, and he'd been studying and reading all about the sunlight stuff. So he took the patient out in the sunlight. He didn't think this patient was going to live. And they took him out in the sunlight, and a week later he was discharged.
Okay.
So then he had another patient, wasn't his patient, but a patient that the mother called him and told him about it. The boy was 15, and he got an infection in one lung that was a fungal infection, and it was so bad that they removed the lung.
Wow.
And then the fungal infection went to the other lung, and nothing was working on it, not all the medication, nothing they were doing, and so the parents said, we need to prepare him for death. And so what does he want as his last thing to do? And the only thing he could think of was, could I go outside? They took him outside. This was in the northern states, but it was in the summer, I think. So they took him outside and just let him sit in the sunlight. And that evening, or the next day, his blood work had improved. And he wanted to go out again. So they took, this is a lot of work for the nurses with tubing, and you're on a ventilator, you're all this, but they did it because they thought this boy's dying. They took him out again, and the next day his blood work improved more. In about 2 weeks he went home. And his lung went from being completely congested and clouded to completely clear. So because of where we live up here in the north, it's hard to get out in the sun when it's -20. that's why we got one. We got a double sauna with infrared, and so it's a little more expensive, but $230 for infrared plus. That's a double sauna, so you don't have to get a double one, and the single ones are cheaper. It's just more fun to do it with somebody, but you can get a single one anyway. So we did, where are we going to put it? We wanted to be close to our bathroom because as soon as you get out of it, you are sweating, and so we put it by our in our living room. Okay, it's right in the middle. It's in our living room. We don't have that much company, and it's kind of to the side, and so yeah, and it's really nice. You get all sweaty, and Wayne doesn't like to take in water and everything, but I get really thirsty. The heat, I get hot fast and easy, and it affects me worse. So I took in a cold ice thing of water and a washcloth, and when I start getting hot, I start putting it on my forehead, and I have my water, and I'm drinking it like crazy, and yeah, Wayne drinks way more water than I do normally, so he's probably well hydrated. Anyway, it doesn't bother him, the heat doesn't, but anyway, we'll talk more about hot and cold later, but I just want to tell you that these things are available online if you want to buy them, and we're going to show you how to do it without this, with just what you have at home. But this is not a bad price for a double sauna, if you have a spot to put it. All right, you ready?
Well, welcome everybody. So happy you all came here. My name is Ryan Griffin, and I just graduated from Eden Valley Medical Missionary Institute. And today we're going to go over hydrotherapy. Over there they have a lifestyle center that they use this hydrotherapy treatments for. And most of the patients, I'd say 99% of them are cancer patients. So they actually do what they have over there is fever baths. And basically they do like a combination of like hydro and then also like sauna back and forth. It's like a supporting treatment to combat. And the main reason for like the fever baths is when the water temperature is at 110. At that level, it starts killing off cancer cells. So it's really important, and it has to be a duration of like around like 30 minutes. So obviously we don't have like a medical, like a hospital grade fever bath tub. So I'm going to show you revulsion therapy, which is similar to that. Basic revulsion is contrast and temperatures rapidly. So you're just drawing blood circulation to the surface of the skin surface, I should say, and pulling it towards a specific area that you're treating. So what we're going to do here, as Isaiah is going to be my guinea pig, we're going to do a chest and back. And when you're going to be using the revulsion therapy here for the hydrotherapy treatment, you're mostly treating like congestion from like the head, chest, and it can be in the pelvic area as well. So this is great also if you have like fever, have onset of, I would say, you have arthritis, inflammation, cold, flu. This is like a perfect therapy for this. And you can do it right at home. We normally, like I know at school we had like a massage table, but you can just use like a table like this. You can, person can be lying on the bed. So there's multiple ways that you can do this in your home, and it's very cost effective. As you see, it's just like a pillow. You have like some padding here.
It's a camping mat.
Yeah. See it? It's blown up. Just have like a fitted sheet. We're gonna have a water basin. We're gonna put the feet in. And then you're going to need a bunch of towels. And we're going to have a bowl of ice water. So basically how this goes is you're going to have the client or patient lie down on here. You're going to fill this up with hot water. And you're going to use, I have a temperature here. This, you want to make sure that the water is at 104 Fahrenheit. It has to be at this temperature to pretty much induce sweating. And when the patient is lying or the client's lying down here, is you're going to have the feet in here, and they're going to be up like at an angle. And we're going to do 2 fomentations. One hot, again on the back, and then one on the chest, and then we're going to cover them up. So I'm just going to prepare right now and get the hot water and then cold water. And then we're going to bring our demo guy up here to show you how it's done.
I'll leave. You want to take my I'll blend you.
You bring your bathrobe there, young man?
No, I didn't.
So you can also buy these hydroculators on Amazon, and they're made with clay, and you can get them wet for your hot pads, but they are expensive. And then to buy the machine that goes in it is $500. And so this is what I made years ago. I just took a wool blanket, cut it up to make my hydrotherapy things, and then just stitched the end so it didn't ravel. And you can use several of them to have a good pad. And we'll get these hot, and then that'll be between the towels so he doesn't get burned. And wool, this is wool blankets, wool holds the heat. So you can do that, or I also, years ago, bought these wool for fomentation pads. So you can make something like this or buy them. But the hydroculator pads, I thought about buying some, but they are expensive, and I want to show you how you can do it at home right now with what you have. And if you don't have wool, you can use towels. You know, you can use towels in between the towels. So you can do this at home with what you have. So you want me to lay this down? So you want to, the main thing is you don't want to burn the patient. So you need to make sure you have towels, especially we don't want to burn Isaiah.
Yeah.
But you want to make sure you have towels protecting your bed or whatever, but mostly what you're worried about is protecting the patient. You don't want him to get burned. And so thankfully Isaiah is totally with it, and he can tell us if it's too hot, and we can get it off him right away. You know. So, but if you're doing this to a child who maybe has congestion or something, you want to be so careful. So careful. Lots of padding. lots of checking to make sure they don't get too hot, that it just warms them, and then cold. When you do hot and cold to your vessels, it dilates and constricts and dilates and constricts, and anything that does that to your vessels helps healing, because perfect circulation is perfect health, and anything that increases circulation is going to increase your immunity.
Do you ever do this to like a person or somebody who may be unconscious but that needs to do it?
I would be a little worried to do it to
Right.
someone who's unconscious because they can't tell me if it's
Right.
too hot. Yeah, I probably wouldn't.
Right.
And they'd probably be in the hospital anyway. So.
So
But I was thinking more of a child that they can't always tell. They don't always tell you.
Right.
Yeah, here's a towel for
So ideally, you're gonna have the person naked.
Normally they
yeah,
should
he-
wear like.
Yeah, but we told him to wear a
swim
t-shirt
suit or
and be fine.
Yeah.
Yeah.
Because you're gonna sweat a lot.
Yeah.
That's what you want
Right.
is to get
Yeah,
all that toxin.
And that's why we chose a man and not a woman. Yeah, but
Yeah.
exactly. Yeah. Yeah, got it.
Just, checking here.
Yep.
And if this is really hard to do on yourself, okay?
Yeah.
So if you are alone and you want to do a hot and cold treatment and you don't have anybody to do it on you, take a hot shower with the cold. So hot for 4 minutes, cold for 30 seconds, and you can do that back and forth at home. And Isaiah does that all the time at home, so he knows how to do that hot and cold.
Well, I do more cold, but I did do hot and cold.
Well, the hot and cold will
Yeah.
dilate those vessels.
Well,
Did you check the temperature? So, when I took a class some years ago, they told me I had to have a water thing, and the only thing I could find was a pool thing. So it has to check the temperature of the water. But it works.
Exactly.
well, not yet, but you know.
Yeah, it's really hot. It's really hot. So we might want to. Roll back.
You might want to slide ahead a
Yeah,
little
that's
bit too.
Okay.
Yeah.
Get comfortable on this moving bed.
Is that better?
Should
Yeah,
that's
you're okay.
Yeah.
Okay.
That's nice. That's really nice. We could just go get some cold water. Yeah, that's really hot.
Isaiah.
Yeah.
Don't kick the bucket, all right?
Yeah,
Oh.
No, it's not going to do that.
Give somebody a
I
back.
That's a
know
good
you're in good hands.
Pete, Brian's all straight.
Yeah.
Good hands.
Yeah.
No.
It's a pool
Oh,
thermometer.
pool for a pool, yeah.
So the water's going to cool down fast, but because we don't want to wait here forever, we'll cool it a little bit. Because that's still really hot. I have a hard time with it. But I have a hard time. I do warm and cool for my hot and cold.
So 104 is actually quite hot.
Yes, yes. So imagine when you're doing a fever bath, it has to be 110. You have to stay submerged, so we're just ahead above water. Yeah.
So what is it at?
Oh, yeah.
Very strict.
It's hot. That's good. Why don't you,
I would try it.
why don't you put a heel in and see if you can help?
That's like, you don't feel it?
Well, that's not good.
All right.
A lot more cold?
Put a little
Just that
bit,
tap,
yeah.
yeah.
Or switch it around.
It's fine.
Yeah.
That's fine.
Okay, I'll get some more cold.
Just 110.
We want him to enjoy it, okay? It's not supposed to be like a misery.
So they don't slowly increase it to 110?
No.
Really?
Like if you go on the ocean, it gets like super cold and it's slowly going, it's the same thing. When the temperature's hot. Yeah. You just kind of stand in there and just kind of keep it down. And your body will adapt.
Okay, that's better. When I can't even put my hand in, then that's up.
Got it?
It's still hot.
Here, come on, second if I'm there.
Alright.
I'm not used to hot, I'm used to cold. Maybe.
You want more cold?
Well, I don't know, is it 104?
We can't read that.
Yeah, it's kind of,
I think I'm getting it.
That's a
And if I remove my feet, I think I'm actually.
Oh yeah, it's working. It was all the way to the top. That was,
And no wonder it's hot.
yeah.
Put it in the ice water real quick.
That's what it's,
what I gotta do.
oh, will that work?
Yeah, you gotta put the fomentation back.
I thought that was, it's 105? Oh, it's 105.
I don't need my foot.
My weight says it's 105 now, and that was after the top.
So when you're gonna do this part, you always wanna make sure that you have the gloves that are definitely heat resistant. You don't wanna be burning yourself, cause it's boiling water, so.
But before they
That's
had,
boiling water?
yeah.
Yeah, it has to be like hot to retain the heat.
But before they did that, I would, in the old days, before we had these silicone gloves, I would just use tongs and wring it as
Yeah.
well as I could, and keep it in a, and we don't want to scald it, please don't.
Ew, stop for life.
Just put them on simmer.
Yeah,
Very
right.
nice.
Yeah, I know, I was thinking one more time. That's why I brought all these.
Yeah. Put it over.
Therapeutic.
Yeah.
Okay. And you won't feel that right away, but it'll come.
Yeah. Get another towel.
So that towel's folded multiple times?
Well, you got
It's
two
a double
towels
wrap.
next to your skin and one towel. Are you guys stressed out?
When you're gonna put one of those on top of it?
Yeah.
Yeah, to hold the heat in. Nice. But I almost,
They're gonna get you warmed right up.
Yep.
That was nice, yeah.
so when it becomes too hot, let us know.
In the back of the front.
But right now, we should be timing it for 4 minutes, right?
Run.
Well, we're gonna drape them with that blanket. Do like
Okay, but timing, anyway.
3 minutes.
So a wool blanket will hold the heat best, but you can use any blanket you have.
So what is exactly that for? Like injection or something?
Congestion,
in the chest.
pneumonia, any kind of coughing and stuff that you're having.
And you always want to make sure when you're draping that you're covering the foot basin.
So that the heat then is
Yeah.
rising
You want to
in.
tuck them.
We're not doing it perfectly, but then you see that it doesn't happen perfectly ever. You do the best you can.
Are you warm, Isaiah?
This thing,
So when your back starts to get too hot, please let us know. So then you time it.
comfortable.
So now at this point, you're going to wait 3 minutes. And while you're waiting, you want to reduce the heat so that the person will start sweating. That's what you want. And that's you create a tent here so that way the heat's going to stay inside.
And this is the same for an adult or a child?
So,
They've
so,
given you a handout on it.
Is it too hot?
Too hot?
Your arms still hot?
Move it
Okay, better.
down. Okay.
See, and so you want to question them too and make sure.
Don't burn my phone.
are you gonna pray for him
He
too?
can go out and roll
Yeah.
around in
Yeah,
the snow.
I think you can.
Yes, and then we're gonna pray. Very good. Ready? Okay. Dear Heavenly Father, please put your mighty touch when they say it here, and may you make this treatment, Lord God, that you have used way back, in Old Testament times, to relieve the congestion in this around the lungs and everywhere else in the body that we can't see, and may have a full recovery in Jesus' precious name.
So 1 more minute.
Yeah. So it's 3 minutes. You wait, and then after that, we're going to do the full mitten friction, which is what you're going to do is 30 seconds for each fomentation. So I'm going to have him sit up. I'm going to do his back first. I'm going to take the hot fomentation off, and you're going to rub that specific area.
With
for
ice
30.
water.
Yeah, with ice water. So you would just put like a towel, or you can take a block of ice like in a cup. You can use that. And then after the 30 minutes, you're going to do the same thing with his chest. And you always want to, when you're kind of going back and forth, make sure that the water, ask them, how's the water temperature on your feet? It's good, not too hot. Okay. Make sure that this is always warm and hot. And when you do pour it, like the hot water, like you're going to refill, you always want to make sure that you have them lift up the feet on the corner here, so you're not going to burn them. And just always pour it like over here in the corner.
Yeah, when you add heat, because
Yeah.
the foot bath often gets too cold.
Yeah. What you're going to do, you're going to repeat this cycle 3 times.
But
That's
we're
it.
not going.
No.
Over the
We'll
course
be
of,
here like for
Well, so it's
over the
3.
course of like a couple hours?
So it's
Yeah.
3 minutes, and then the ice rub, then 3 minutes more
Yeah.
with the heat, and the ice rub, and 3 minutes more, and so you do 3 or 4 times, and then you end in cold. You wrap them up and send them to bed.
You end in cold?
You end in cold.
Okay.
Yep. You always end in cold. Okay, it's nice.
You better poke him a few times, make sure it's well done.
I'm all done.
Okay, so then what we do, we can do the chest.
I want you guys to see, but I want to be able to help. So you want me to take it off so he can sit up? Or
Yeah.
just take the whole thing off? That's not that hard.
No.
But I can see
Yeah.
that.
Yeah.
So I'm just gonna like mimic it because I don't want him to like take his pose, but
What you would do,
sit up. Sit up. And then let's say I start off the chest, you kick off the fomentation 1 area at a time, and then you'll rub and you'll count for 30 seconds, like clockwise, like that, in the motion. You just keep counting and counting, and then you ask the patient, how's that feeling?
And usually they are so hot that it feels
Yeah.
wonderful.
And then you'll obviously you'll come here and you'll be doing the back
in
side
just
as
the
well.
3 minutes, they get that hot?
And when that's done,
You lay them down again on another one.
another fomentation, keep it here. And that, because it was in the boiling water, will stay hot the entire time. So you don't have to put it back in the pot to like reheat it.
And when they're completely done, if you lay them down and put them to bed, it will really help their immunity, just if they have that rest afterwards. And it's the same thing with the press, right? Pour over ice water.
Yeah, so let's say I was at the 3rd time, and obviously the 3 minutes is done, did the 30 seconds. Now the person's obviously going to be done, and then what you do, you always finish off with cold. So then you would just take this off, And you would have them like raise up their feet. Yeah, and we'll just rinse it like over. And they would just pour over their cold like that.
He's feeling that.
He's feeling that. And then have them come out.
See, and to touch, his foot is really hot, even though he's had the cold put on it. You can feel
Yeah.
the heat. So that's why the cold immediately goes away because their foot is hot inside, and so the heat comes out.
Because you know his nervous system's working.
Yeah.
Right.
So it's working.
All right.
Dry them off.
So then you just dry them off and put them to bed.
That's
What?
it.
I have a question,
Mhm.
for a diabetic person.
Yeah.
Can you do that too, or?
You want to be very careful because they don't have feeling.
Right.
Yeah.
So then you have to really watch the temperature
Yeah.
to make sure that it's not too hot.
Yeah.
And use your own skin and everything, yeah, but you need to be careful if they have neuropathy in their feet. Now, do you want to go to bed?
I'm ready for a nap.
Sorry, it's a Russian steam bath.
I'm enjoying it.
We're gonna rush in next.
Yeah, that's what's next on.
Next.
Okay, so let's see. We're going to see what Isaiah's temperature is. That's kind of there. 96.3 is what this says. It's kind of cold.
Oh, that's strange.
Here, there's the 98.8, so higher up there. Yeah.
Do you usually run low?
Did your
Did your temp usually run low?
Yeah.
Explains
I
it.
have a cooler temperature.
Oh, yeah.
With all those
Sit
cold,
here.
So
cold
what do
showers?
you need now? The tea kettle?
Yeah.
I'm gonna need the instant one.
Mhm.
We're gonna put it in the back and then we'll trace them.
Ryan, can you tell us a little bit about your training at Eden Valley?
Yeah. I was I trained over there on the medical side. We did obviously they had the lifestyle center, so we did like the bariatric or the HBOT chambers. We did saunas. We did Russian steam baths, and then we did like the fever baths. So we were actively engaging, like doing the treatments for the guests that were there. So we helped like the therapists that were there were under them. So they would just be supervising while we were actually doing the treatments on the patients. And also we did teas, like a lot of herbal supplements and teas, poultices, like castor oil, frankincense, and then we did the charcoal poultices as well. Especially for patients that have like tumors like in the back and whatnot. So we would do the charcoal poultices and have that just, cut them out. Actually, what we used was like puppy pea pads, which are actually great. And we just kind of cut them up in the specific area where the tumors were at, where the cancer was, and localized it, and then put just obviously like the charcoal made like a paste, put it like in a Ziploc bag, froze it, and then we would take it out and then give the patient, and then they would just help them apply with like some saran wrap, and then they would have that there overnight and then throw it out the next day. She always wanted to do a clean one, but with the castor oil, you can actually reuse that. So you don't throw it out. So you can use it like 2 to 3 times, which is nice. And actually, that's work. But it's best at the end because they have a 10-day program and a 2 weeks program. And at the end of the church on the last Sabbath, they would go. We would have like a kind of like graduation type meeting for them in the church, and they would all hand her the microphone and they would say their testimony for the treatments that they had there, and not one. There's never one person that had anything negative to say. They were just grateful because they balance it out, not only health, like medically, but they also do it spiritually because they have biblical response therapy treatment for the patients that they all go to, which is nice. We pray with them and kind of help them, whatever issues psychologically, trauma, whatnot that they go through. So you're caring for the individual as a whole, which is nice, mentally, physically, and spiritually. the whole coming together is just phenomenal. A great way to see God's healing and these patients that have like stage 2, 3, and 4 cancer. Obviously, with the stage 4, it's more like it's more on a spiritual level. But some of them have actually had extended life because they help them. They have counselors there that after they leave the treatment, that they follow up with them and make sure that they continue the treatment when they go home. And just like this. So they show them how to do that and prepare them, so, which is great. And also there they have an herbalist, Linda Gregory is there. So she concocts like all the supplements, or everything is handmade there, the teas. So everything's from scratch, which is fantastic. There's no like synthetic products and nothing like that. So everything's organic. So with the combination of the treatments, it's fantastic to see the results. So I got a mic now.
See the voice.
There. Can you hear me now?
So it's not only a place for patients to go to who need help or relief from different things. So you went here and had training. And so
Yes.
how long is the training for?
It's 6 months, but technically it's like 5.5. Yeah. So it's nice. So what you do is you have your classes in the morning, and then in the afternoon you had your vocational training. So they would train you in all areas, anywhere from like the country store to the herbalist with like Linda. So she shows you, she'll go out and, okay, how do you identify this, that. And they do it in the summertime, which makes sense because obviously the vegetation, so you can do that part. And then you also work on the farm, and you learn how to do like succession planting, fertilizer, mending the soils, which is nice. And then there's the biblical, you do learn the evangelical. So they have a whole bunch of like guest speakers, like Dwayne Lemon would come, and there's Dr. Jennifer Jill, she's doing the mental health side. There's Tapiwa. People come from other institutions and do that. We also learn massage, like full body and just like in the chair massage. They teach us that as well. So it's just so many different areas, which is great. So that way you're at the end, when you're done, as you're praying, have the Lord lead you to specialize in whatever area that you want to do. So it's a fantastic. So they have like your grassroots for the outpost. So you have your educational side, you have your farm, and then you have your lifestyle center, and it's all built like on 600 acres out there in Colorado, and it's beautiful out there. So, and they're just continuing growing. They're developing. They actually want to combine the lifestyle center into one big building, kind of like out here we have here the CEC. They want to do that over there because they're like separate buildings. But yeah, it's a fantastic program, and then you're just involved. And then the other part on the evangelical side, they have you go to other churches and you do sermons and presentations. They do promote the 8 Laws of Health, which is nice. So that's fantastic. New Start. So, yep. Eden Valley Institute. It's in Loveland, Colorado.
I was just wondering, so you know how to go out in nature and see what the plants are?
Yeah, like for like plantain, if it was good for like insect bites and whatnot, they would have like yellow dock and hemlock. Comfrey is huge. We did that, and we dried like calendula flowers. I made our own calendula oil, and made our salves. We did the capsules. We did tinctures. I mean, almost like name it. We did it all. So it's really, really fantastic. And it's great there is they provide you with all the resources for you to take home, and the slides as well. So for each instructor, all that are there. So. Yeah.
I was told that a lot of times plants have a double, so you have to be careful.
Yes, they do. That would be Satan's adversary for God's healing element. So yeah, that's why you have to really pay attention that you're getting. When Linda was showing us, there's always like one distinct feature that distinguishes it from the tare from the wheat. So. Yeah, so it's a lot. I mean, for her, it took her like several years, like over a decade to. There's so much information just in that herbal area. It's not something you can just pick up, and you have to keep at it and studying and being active and looking and finding the certain herbs in nature and whatnot. And that's specific to your area too, because if you go overseas, which I'm going to be doing shortly, I go in Cambodia, but it's all different. But the beauty with God is that He has that same healing element, just in a different form, a different plant life that's there. So it's just you need to do the research yourself and go and find it, pray on it, and then He'll guide you to those, and then you can replicate the healing therapy there, which is nice, like through the vegetable, the herbs and vegetation, so which is nice. But yeah, any other questions? Yeah.
What's the cost of that program?
It's $5,400 for the 6 months, and I'm not sure. They might be increasing it this year. And I heard on the grapevine through the directors there, I think it's going to might increase like 600, so it'll be like an even 6,000. Yeah.
How about for a patient?
That's around for the 2-week program. I believe it's a little over 6,000. Yeah. I know. Yeah. Yeah. And no.
Sometimes insurance will cover it.
Yeah. And there's been people there that I know like their churches have helped paid a portion of it to help them so that they could go. They average around 12 guests that are there. On a low is probably like 6 to 8, but most of the time they have around 12. The highest in the peak season this summer, they've had up to like 19 patients, which is a lot. And they would put some of the guests in some of the staff housing because they didn't have enough space. That's the only problem there. They don't have enough housing like for staff and for a large amount to handle for like guests and stuff like that. But they're already in the work of building a project. They had Maranatha that was there when I was there, and they're building some additional buildings, which is great. So, but God's definitely there, and He's leading, and the place is growing. It's a huge beacon of light. So the fun part I like is the farmers markets when you're in the farming program, because they go out in the areas, and then you can do evangelizing and you can talk about it. So it's kind of nice. Yeah, that's good. So now we're going to do Russian steam bath. Sorry, I got sidetracked. So we're going to need the curtain. Oh, you have it? Okay. You're going to want to take off your shoes. Yep. Sorry, no, you might as well just keep it off. Yep. And then we're going to need this. This is really cool.
Every class that I did on the Russian steam bath, they said that if you have previously ever smoked,
Yeah.
it's oftentimes when they cover you with the sheet
40 years ago.
and do the
Yeah.
steam, that the sheet will come out with yellow
Yeah.
on it.
Yeah.
Even if you've quit smoking, that those toxins are still in there.
Wood chimney.
And so
We're going to find out what's in you.
well, he's got clothes on.
Yeah.
Be that long, but so they told us that some of their patients. Do you do this next? The towel, the sheet.
You have the shower.
Oh, the shower curtain.
Yeah.
Yeah, it's over here.
Yeah.
So they told us that sometimes they've come out, and so this is a yellow towel. Okay, it's
Yeah,
not
yeah,
it's
I'm not
not
gonna burn you.
discolored, but the patient would come out like this yellow with smokers, because those toxins are under your skin, and when you start sweating it out, and they have you drinking a lot of water, and you're sweating, and yeah. So that's the other thing we forgot here is we should have been giving him water when he was laying there, right?
Yeah, you hydrate, but you don't want to do it in the beginning. You want to do it towards the end because
Right.
you need them to sweat to get out all
Yeah.
the toxins
Yeah.
out. Yeah,
And then when you do the Russian steam bath, you also want them drinking water.
right.
Okay.
So another thing to add when I was doing the fever baths, which was great, is when we're cleaning, right before we clean the tub, you would always see like a line on the outside, and that's all the impurities that came out of the person. Wow. So it works. It could be, if they were smokers, or especially with the cancer patients, you would just see this like dark, thin line around the tub. So It definitely works. You don't see it?
But I'm not seeing it.
What
Oh,
about
it's here.
a smoker? What would it show like today? You know, if you're a smoker, it shows on the
sheet.
Yeah.
sheet. What about if they weren't a smoker?
Yeah, they probably
Yeah.
won't have as much unless they have if people have other toxins.
Yeah, exactly.
Right.
Free radicals.
It will show too the other.
Yeah, but the smoking toxins are especially.
Yeah.
Go ahead.
Now you're ready to be.
Yeah, what is that?
Yeah, I'm gonna put some warm.
When you have all the heat on the chest and the back and the feet, you don't put a cold cloth on the forehead.
Yeah, I probably would have. Yeah. A cold cloth on the forehead.
Yeah, you do that when towards the end, as soon as they start sweating for like a minute, then you can put like a cold compress or a towel on their head just to cool them off briefly.
So you do the shower curtain first, is how
Yeah.
they taught you?
Yeah.
Oh,
yeah.
we did the sheet over it because otherwise it doesn't get the toxins
Yeah.
on it.
Yeah, we do that's how they showed.
Okay. So you can do it differently if
Yeah.
you. Yeah.
As long as they're draped and they're covered, that's all that matters. And you want to, at the end, we're going
about
to,
getting them to sweat.
yeah. And you just want to get some clips because you don't want
So I just
any
bought
air.
clothespins to clip I went to the laundry section and bought clothespins so we could clip the blanket shut. And I had the little clothespins, but I didn't know if they would hold the blanket. So even a popcorn clip or, to do a bag would work. Yeah. Probably even hair clips would work. Yeah. Just anything to hold it so that you actually have it closed.
So a big shower curtain is important.
Yeah.
Yeah.
No.
Yeah, right.
Small one's good for you.
Yeah.
People that are a little bigger.
Do you have the instant
Maybe two shower.
Yeah,
kettle?
I did. I was just waiting until.
Yep, yep. Like this could be
So
there.
if you have one of these instant pots, that's faster. But even an old tea kettle will work. And you just boil it, and then you stick it underneath their chair. With the steam not facing their legs, okay? So coming out. Oh, so you have the steam going out the other way. Oh, this one you want.
Yeah.
Okay.
I'll need the hot.
Oh, you can
and I
keep
need to
it
plug
plugged
it in.
Okay.
Yeah.
Okay.
Oh, so you can leave it plugged in?
Yeah.
Okay.
Now, it turns
I'm used
off.
to using the old style.
Afterwards?
No, you leave it on the whole
It's
time.
not plugged
But I
in.
mean, sometimes they turn off automatically.
Yeah, they do. Then you do have to make sure that it's like turned on. Yeah.
So it has to stay on.
Yeah, the entire time. Unless you're gonna burn yourself. I'm gonna wait.
You're going to get a cut after this, I'll show you.
Yeah.
Pull off the top.
Yeah.
Okay. Do we have a? Huh? Okay. All right.
Should it be a wooden chair, metal chair, doesn't matter?
Usually a wooden chair is better.
Wooden chair's better?
Yeah.
Yeah.
Where's the plug-in? I'm not seeing. He said on the floor. but I'm not-
Oh, over there.
Where is it?
Look behind the.
A person
Yeah.
can do this for themselves in their home, right?
Yes.
It'd be more challenging, right? Because
Correct.
You would never be able to wrap yourself up in that.
No.
I'll tell you how they showed us at Laurelweld is the nurse who does it for the Dr. Howe. She said how she does it when
Okay, is
she's
that
home
too
alone
tight?
and wants to do her own sauna. Is she just clips it in the front.
oh, that's a great idea.
Yeah.
Go.
Yeah.
Perfect sense.
And she sets the tea kettle out ahead of time and gets everything ready, and then she just
Yeah.
clips everything in front.
has her water right there. Everything's right there.
How's this?
So it's down here.
That's a good idea.
Oh, there. Okay.
And I would have
Put
it
the open
facing
side
this
in
way.
front
You
of
don't
it.
want it facing towards them.
No.
You want it,
Oh, you know what?
you need it under the chair, though.
We need to put the towel on the
So we were
chair.
gonna do this week, because you were sick. But I kept forgetting because you were sick. Yeah, just a hot foot.
We need
Hold
you
on
to
one
stand
second.
up. Oh,
Need
you
you
don't
to
have to
stand
take
up.
them all out, do you?
No.
Just have them stand up. We just need a towel in the chair so you don't get
Yeah.
burned.
Get like 2.
See, and that's why she had the sheet right on them.
Yeah. Yeah.
Okay,
And then one on the back.
okay.
No, not yet. Yeah. Almost.
So yeah, we did the hot and cold foot back.
Okay. Yeah.
Okay, there you
Okay,
go.
now you can sit. Yeah.
There.
So you always want to make sure that you have a double layer or a triple layer of towels. So that, because when the steam's going to come up, it's going to make the chair really hot. That way it's comfortable for them.
That's why a wooden chair is better because it transmits heat slower.
Exactly. Then you're going to drape them.
You didn't get mine. I'm so sorry.
Hey, Tammy, can you make sure that it's tucked in the front, please?
My feet get soft. I think the temperature is dropping on the foot down.
Oh, you want it hotter? Okay, I'll go get some hot water. Yeah. Okay. Pass. One of these. You know how to do it. And here's the. And then there's pens up there. You're welcome to if you want to take notes.
So I mean,
So the purpose of putting like the smaller towel around the neck is you want to prevent any steam from escaping. That's why you want to make sure that there's no openings in the back either. So it's going to create a sauna effect, which is what you want.
So his feet are cold though already. So the water gets cold fast.
Yeah.
So when you put the new water in, I'm going to have him move his feet over so he doesn't get burned. And I'm going to put my hand between his feet and where I put the hot water on, so I'm sure that he doesn't get burned. His feet are in a bucket of water.
baby.
Yeah, a base. Yeah. It's good?
Yeah,
It's
that's
good?
good.
Okay.
You feel the steam?
Oh, I do the steam now, my hands.
Yeah?
I think there was steam.
Okay.
I don't know what arms they must feel like.
Yeah, right.
What's your preference, original or extra crisp?
Yeah.
Okay, I need
Survival.
a water
Right.
for him to drink.
You still okay?
Yeah.
Okay.
Feels comfortable.
Good. So I think with the instant one, sometimes you have to like make sure because it automatically shuts off. You want to keep running,
Yeah.
and you'll have the person here for 30 minutes. So you always want to keep them, check on them. How are you doing? Or, are you too hot? And if they're getting too hot, then you would put the cold compress on their forehead, and then you can lower the steam in the back. So it's not like you want them burning in the back at all. That's why you put the towels there, so they absorb that hot moisture.
And since their hands are all in here, it would be really nice if I had remembered straws. But it's really nice to have a straw that you can just, but this way we're just going to let him have a
Yeah.
drink this way. And I won't throw it in his face or anything.
Yeah. As the metal, it can
Gets
the
hot.
hot absorbs the heat, and it can actually scald the person. And I mean, you could, but you just have to put like double the amount of towels on there.
Or a blanket over
Yeah.
it or something.
Because even with the towels, when they're leaning their bodies, pressing up against the metal, they can still get some burn marks. Yeah.
So it's getting pretty hot in there.
Yeah.
Yeah. Yeah.
You feeling
I'm glad I
it?
got my pants on.
Yeah.
One or two.
Yeah.
Yeah,
You can start seeing the sweat underneath.
Wow,
Yeah.
That's really hot.
Yeah.
Should it be that hot?
So again, 30
Yes.
minutes. Yeah.
Yeah.
Out of my hands.
I
Yes.
Yeah, yeah.
I'm gonna need it all over.
Here.
Yeah.
Here.
And when you see the person start perspiring on the forehead, that's when you want to.
So this
Put
is how
that
I
on.
am when Wayne and I do a sauna. This is how I get. I get
I'll
hot,
put
really too hot, really fast. Here, do you want the thing on your forehead?
No, I just got, I think I needed more of a towel under me a little bit.
Oh,
Yeah, it's
the
a burn.
chair is getting hot.
No,
Yeah, is it?
it's just the steam. It feels good right
Are
now.
you turning the steam
feels
to
good
the
now?
back so it's
Yeah.
not hitting his leg?
Okay, good.
You sure
I
you don't
fixed
want
it.
this?
Yeah.
Yeah, you put it
Yeah.
I'm gonna post
Doesn't that feel good?
Yeah, that
Yeah.
feels great.
Yeah.
And there's your Russian steam bath.
For half an hour, and then what do I do after the half hour?
And then we're gonna.
So,
And then after the 30 minutes, what you want to do with the foot is you always want to finish off with cold. One thing is if people have rheumatoid or any form of arthritis, you always want to finish off warm, not cold, because it can be really painful for them on the joints. So that's the only one condition that you want to do the opposite. But otherwise, you always finish off cold.
listen to your patient.
Yeah.
That's the key. Listen to
Exactly.
your patient. If it's too hot, if it's too cold,
I'm gonna put
listen
this-
to them.
You got the point.
All I could hear Isaiah say, he must be rushing home.
Get out of here. That's hot, half an hour.
Hats
So
off.
you just do one half an hour segment in the hot, and then take a cold shower.
Take
No, you warm.
a warm shower.
Warm shower.
Yeah.
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 So another good way to do is after any of these treatments is the contrast, which normally that like at Eden Velvet they do like with the sauna, when people the guests use them, we would have them. They had like a certain setup for the contrast showers where they had jets all inside on the walls, and you would do what you did with revulsion. So you would do 3 minutes like not hot but like warmer for the water, and then you would switch it to cold for 30 seconds if they can get at that level. Sometimes it's like 10 or 15, but everybody's different, but you do try to endure as long as you can, and then you switch back, and you do that 3 times. So it's the same thing that you're doing with the revulsion. So the contrast with the Holden hot water is just, it's very healing, that you can do at home, obviously in your shower. I don't know if you have a great temperature change extreme like that. I think it was wonderful. So that's mainly what this is here. Sorry, I'm going to take them off here. Free you from the tent.
So if you're doing this to yourself and you clip it on the front
Yeah.
and you get your kettle there, you need to, also the other thing we should be doing with the patient is checking their temperature, making sure they're not getting too hot.
Yeah.
Because Isaiah is well, he's not sick, so he can tell us, but a patient who's sick, you want to check their temperature. You want to,
How hot is too hot for the temperature?
nothing above 102.
Oh, okay.
Yeah.
Yeah. If you go to 102, that's actually therapeutic, but anything higher than that becomes a little dangerous. So
Yeah.
when they get that hot, you need to cool them down.
Yeah.
Yeah.
Spirit gotta go, that spirit gotta go.
Huh?
Yeah, I'm just wiping.
What do you need?
Sweat.
Do you want something?
Here.
I can't sweat.
I told you. Well, it's good. You're detoxing. So the third one, just stay right there, is just, this is easy. You don't have to.
Yeah,
it's
we
just,
don't even have to do it. We just
no,
explain
just
it.
explain it.
Yeah.
It's just a hot foot bath. This is basically equivalent to like a fever bath. So, but the thing with the water temperature, you want to make sure that it is at 110. And you will drape the person like you did with the Russian. Obviously, the one thing you're going to take out is the kettle in the back from the steam. And they will be there again for 30 minutes total. So, and you're going to do the cold compress on the forehead as soon as they start perspiring to bring down that temp if they get overheated. But that's basically it as far as as close as you're going to get for like a fever bath. And again, it's the same concept. The whole point of the draping is you want them to really sweat it out and kill off all the, I'm not going to say like cancer cells, but whatever the person's going through, decongestion, inflammation, could be pain, muscle soreness. If they have chronic illness, it'll help with that. And we recommend, like, when we do these treatments, like at Eden Valley for the fever bath, you do it every day. So whenever you're going through, you do it once a day. So you have, in order for it to really work, you have to be consistent with it and dedicated.
That's where you're actually in a tub of water, a very hot tub of water, and they're checking your temperature constantly. And
Every
they take
5
you
minutes.
up to 102.
Yeah.
And then cool you down and get you out.
Yeah.
And that is to fight off, if your body's not fighting something, it helps your body to fight something.
Yeah.
We're not going to do that here. But the other thing for the foot bath, for me, that I love to do a foot bath for, is if I have a congested headache.
Mm-hmm.
So if you have, like, just a sinus headache or something that is really bothering you, if that is what it's caused by, and I can do a foot bath, my headache will be gone in 20 minutes.
Mm-hmm.
Because the blood will go down, the congestion will go down to the feet.
Right.
And it works.
So when you get done with it, it doesn't go back up to the head then?
No, it usually is good.
Mm-hmm.
Yeah. It's going to depend why you have it, but
Yeah.
yeah.
So that's a great way.
Mm-hmm. It's great for a
Headache.
congested headache.
And then you can also, you don't have to have this, you can just do it like in your tub. And sometimes you can put like with
chair.
disabilities, you can have like a chair in the tub, and you can do it that way, so it's more comfortable and at ease for you as well.
Mm-hmm.
And fill up the tub
With hot water.
with hot, like just right above your ankles, and you can do it that way.
Mm-hmm.
And so there's different methods, but the best thing is that you can do this treatments at home. You don't have to have all these expensive equipments. As you see, it's very inexpensive. You probably have everything at home anyway, and you can treat yourself rather than going across to some pharmacy or whatever and buy pills and synthetic to treat headaches or whatever. You can just do this, again, for free, pretty much at home. And it's natural, and it works.
However, if you're seeing a doctor, we are not trying to get you
Yes,
off your medication or
yes.
anything. That's between you and your doctor.
Right. So the last,
So then you end on cold, even with the...
yeah, you always end on cold. And again, if they have arthritis, you always end warm. So always keep a note of
So
that.
you want to do that now for him?
I'm going to do the salt glow
Oh, first?
while he's in
Okay.
there. And I'll do the ice one last.
Okay. All right.
So we're going to do a salt glow. And this is good for, like, even with people with
Did you
diabetes.
already get some?
Huh?
Did you get some yet? Oh,
Yeah.
there you go.
So it's a salt scrub that you put on certain areas, like target areas on the body, especially like the legs. So if a person's in the middle of doing like the foot bath, you can do this so that way it's less messy, but you can do a combined like treatment. And what you're going to do is you're just going to add some Epsom salt in here. I'm going to show you, add a little bit of water and create kind of like a gel. And then what you're going to do is you're going to wet that area first, and then you're just going to like scrub it like in a rotation area for about like 30 seconds.
So this is an exfoliating thing. It exfoliates the dead skin.
Okay,
Right.
so
But
you don't just put it in the water?
No.
You do put it in water, but you use it as a gel on the washcloth and rub it
Yeah.
around. And so it exfoliates your skin, but it also any kind of
Exfoliate you.
any
Yes.
kind of thing to help your circulation is good. And so the fact that you're rubbing this on is going to increase your circulation to that area and possibly help with healing. Or you can do it as a beauty treatment if you're worried about exfoliating something.
Don't worry
Yeah.
about
Yeah. Me either, Veronica. Whatever.
A little bit more. You just kind of want to get like a
So
almost gel consistency.
this is just regular Epsom salts that I bought at Walmart in the pharmacy section. So nothing big.
I can wait and do beautiful and Heather.
There.
Me too.
I have a question. Could you use any Epsom salt, or it has to be plain? Like,
You can
know,
use
the
any.
lavender
Oh, you
or
can
something?
buy some with the oils.
And what you can
mixed
do
in.
is what we did is that we add like essential oils. You can put like
Yeah,
eucalyptus
they
and
have some you
whatnot,
can buy with
frankincense.
essential oils, but they were
Yeah.
a lot more expensive, and I bought the cheapest. Okay, but yeah,
Yeah,
yeah, they do, they do.
yeah.
Yeah, yeah.
Could you use those that already have the eucalyptic or the
It's up to you. Yeah, totally up to you.
Yeah. So,
Brush his teeth now.
yeah. He's going to do some pulling. Yeah. So it's like at a gel consistency, and that's what you want. And you're going to wet the area. And this is good, like, again, for exfoliation, but it's also for blood circulation in that area. And it can stimulate the nerve activity in that area. So that's what you're going to do. I don't care. I'm going to wet it. You're going to wet the area first. You probably can't see.
Which one? This one? Or this
And then you're going to take like a clump,
Yeah,
like
you
this.
You can do anything.
And you're just going to massage it in that area. You'll do that for like 30 seconds. And it is messy, but
There, can you see
it
better?
works. Yes.
Okay.
You can grab
Here.
a little bit more.
We can put it right here. Okay. That's good.
How does that feel there?
Just like an exfoliator.
There you go. So women can do this to beautify their legs. How does that feel like?
And then you're done. You just
Oh, yeah.
rinse off.
Or on the feet to get for the heels, where
Yeah.
you got dead skin on the heels.
From the knee down.
You can do any part that needs.
Sorry, am I too loud?
Oh, okay, if somebody has an existing issue.
Right.
Concentrate on the area.
What's good, like, again, like for diabetic patients, because it increases the nerve stimulation in that area, since they have desensitized mostly.
So
in
is
their
the
legs.
water in the salt cold or hot?
The what?
The water in the salt, is it cold or hot?
I do it like room temperature.
Okay,
Yeah.
so lukewarm.
Yep. And you can do this, on your arm or any part of your body. You might have like inflammation, or just if you just want to exfoliate, whatever. So there's multi-functions, but it's great. It works, and it's all about basically most of these treatments is just stimulate increasing blood circulation, and for the immunity, for the white blood cells, get those cells flowing so that they ramps up the healing process in the body is what it is.
If I had a kid that had diabetes,
Right.
and she had thin skin because she's older, would this be a little bit too much, or?
You can do it gently. What you can do is you can water it down where it's not so gel, a little bit more liquidy, and just do a softer rotation, so that way you won't tear like the skin or anything like that. So, because we've done it over there at Eden Valley, where especially with the cancer patients, where their skin's just really like super tears easily. So we really water it down as much as possible, but where it's still a little bit grainy, and then you just kind of slowly like massage it, and they absolutely love it. They like it, and you see the skin. It should be like a pinkish color, and then you see that that it's like working because the blood flow is concentrated like in that area. And the last one we're going to do is ice massage. This is like the easiest, but it's very helpful.
The easiest for Ryan, but not
Yeah.
for Isaiah.
Right? He's such a good, yeah.
But this is if you have an injury or something and you need to do icing, you can do this.
Do you have scissors?
Oh, yeah.
Possibly.
Yeah.
Yeah. Maybe I should do another one.
So what Ryan told me is when I was getting the ice ready, is he told me just to take some plastic cups and freeze some ice so that you have something to hold on to.
Yeah.
And it's a big ice block, and you can just do it in your circular motion.
Ooh. You can do that one too. Actually, I think I can just hold it.
You want me to get you something? Here. Do you want to use this, or do you want to use
that's
those
fine.
gloves?
Yep, it's okay like this.
You're okay?
Yeah.
All right.
So this, when you're going to use the ice massage, is let's say like you're have any muscle soreness after if you're exercising or if you pulled a muscle, something like that for localized pain. Yeah, like you know. And what you're going to do is there's four stages to this. So the first one is cold. The second one is burning. The third one is aching. And then the fourth one is numbness. So you're going to keep massaging, and you're going to communicate with them so you know what stage they're at. Once they hit the numbness, then you take it off, then you're done. Yeah. So ready?
We're not going to go that far, are we?
We'll see.
Well,
You ready?
he doesn't have an injury. We don't need to do it that long.
All right.
Fine.
Fine.
How long does it usually take to?
Everybody's like different.
Does it have to be there? Could it be like in this area?
You kind of, you don't want to do it on like the joints. You always want to do like where there's muscle.
Okay. So what's the stage? What's the first stage?
It's just cold.
Cold. Yeah.
And then it goes to like burning,
No, hurting. Not
burning, and then aching. And when it gets to numbness, where you can't feel it anymore,
How long does that take to get to that stage?
sometimes it can take like 30 seconds, 15 seconds.
But not like 5 minutes.
No.
Okay, so it's getting close to numbing.
Does it get in there?
I didn't feel the burning, but it's getting close to numbing.
Okay. You're feeling it.
I feel something there.
So you don't feel the cold anymore?
Yeah, but it hurts.
Yeah.
So
You
it's
start-
burning.
Yeah, you start feeling pain.
Yeah.
Yeah, it's no more colder. It's not cold. I don't feel the
Yeah.
cold. I feel pain, like I got a Charlie horse almost.
Okay.
Yeah, that's getting numbing.
It's getting numb?
Yeah, it's getting there.
You better get there soon.
Done.
Yeah.
You're a tough old man.
Yeah. I see.
Just tell him it's numb to Isaiah, and he'll quit.
Yeah.
It's getting numb. It's getting there. It's hard to feel the rotations. No,
Yeah.
I don't like it. It doesn't feel very good. The thing that helps is that my foot is in water.
Yeah.
In
yeah.
warm water,
No,
so that
normally
helps.
you wouldn't do it like that. Yeah.
It's got to be numbing.
Just tell him to quit, Isaiah. It's
Yes.
okay.
Yeah.
You're done?
I
Okay.
think it's numb.
Okay.
So what do we do
Okay.
now?
Then
Your
that's
hand must
it.
be numb.
Well,
You don't
yeah.
have to suffer.
So that's as far as ice massage. So it's great to if you take some cups like that and like the smaller ones, and just kind of line them up in your freezer so you can just whip them out every time that something happens. And if you have like a pull muscle or even inflammation, I had my education director. She had torn her meniscus in her right knee and it was all swollen. And we would do this on her, and then the swelling just gradually shrank. You do this, I would say, about twice a day. So, and again, you always do it till they're numb. So that's when you pull it off. I know it can be painful with the burning sensation, but it goes quickly. And when you do this, you want to make sure that you're going to do less obviously for when it's like you were mentioning, like the thin skin, like under the arms here, the torso where the skin's thinner. And then, because on top like this, like the feet, on top of the arms and the back, the skin's thicker, so it'll be longer. So.
And then you don't finish off with warm or nothing?
No. You already got your feet in there. So.
But if you want in the water,
Yeah.
stop it, dry it, and that's it.
Yeah.
No more. Okay.
No.
So what about when you're doing that process and the water gets cold? Does the water get cold and you have to change it, or you just
For
keep it warm?
for the foot bath? Yeah, you always want to make sure that you're refilling it to maintain that temperature. That's why it's good you have like a kettle.
Yeah.
If you don't have the instant one, you can always have like a hot plate. So, and that way because you want it close by, because you don't be running back and forth. Because by the time you come back, the water is really tanked in temperature and gotten cooler. So, yeah, you can do your own. You're free. Let's give it for Isaiah. You did a good job. Excellent. Thank you. Yeah. Yeah. Yeah.
I thought it was free.
Nothing for you.
Yeah. Does anybody have any questions at all, or?
So that's
Yeah.
good for, again, the ice massage is good for like sprained ankles?
Yes, exactly.
Okay,
Yep.
torn meniscus?
Yep.
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 Back, how about back sprain too, or
Yep.
back muscle or something?
Yep. It works just like that.
If a person has asthma and they're sick, could you do these treatments?
So
You
someone has asthma.
If they have asthma but they sick?
Yeah, it's actually, you can with the fomentation. It's very good. It's helpful for them because you're just dilating those blood vessels where they can breathe.
It's probably
so.
not going to take the asthma away, but it will help
Yeah.
them during
An attack.
an attack.
Yeah.
Yeah.
Yep. Yeah.
So one thing we didn't show you because of the difficulty of it was a fever treatment. If not a fever bath, but if the person has too high of a fever and you're trying to bring it down, it is what they do with that. I'm going to tell you, but you can look online. There's books you can read. But I did it with our 2-year-old when Michael was 2, and it's not something you like. But when they're 2, you can hold them down. But when you're, I never did it for anybody up to 102, but I personally had convulsions with high fever as a baby, so I worried about my kids having going too high. So when the fever got to about 104, then I would try to bring it down. And so we did this fever treatment where you put a sheet in ice cold water, and you wring it out really good. You lay your little baby down or your child, and you wrap them in that, and then wrap them in a wool blanket fast as anything. But their fever is so high that it doesn't take very long at all, and their body is heating that sheet up, and pretty soon their little face is pink and red because they're getting hot under there, because the cold sheet will draw the heat out of the body to warm the exterior, and it actually lowers the temperature. And so it was amazing. It worked really fast.
Good job. Thank you.
No, out of the body. But you could just tell that they were warming up even with the cold because their cheeks would get pink and stuff. But yeah, yeah. But so, you know, it wasn't an easy thing to do, and I only did it once because of the screaming and stuff. I thought I can't do this, but it does work. And if you're somewhere where you don't have any medicine to bring down a fever, and a fever is really high, it's a way to bring it down a fever pretty fast.
So you should always have wool blankets on hand.
Yeah, or any kind of blanket, but wool is just better. It holds the heat. It holds in everything better. Yeah. Anyway, but it's amazing how hot and cold works. And we talked a little bit about showers.
Yes.
But hot and cold showers, as hot as you can handle it for 4 minutes, and then 30 seconds cold. And you cycle through that 3 or 4 times, and you end on cold. And they say if you do that and then go to bed, Wildwood says this, they're a sanitarium, they say that your immunity will go up by about 200%. If you do the hot and cold, a cycle of 3 to 4 times, 4 minutes, 30 seconds, 4 minutes, 30 seconds, 4 minutes, 30 seconds, 4 minutes, 30 seconds, end on cold, dry yourself off really fast, put your PJs on, and go straight to bed. And you know what? By morning, you might feel a whole lot better than you did.
That's true.
So,
well,
yeah.
I take my hot shower and then I take a cold shower, but I only do it just the once.
Yeah. Well, if you're not sick, it just helps circulation.
Yeah.
But if you're really sick and you need something, then the hot and cold, the 3 to 4 cycles, will because then it's making your circulation do this, you know, and it
really
moves it.
Sick, you're not going to be able to stand up that long in the shower.
Well, okay, I'm not
Yeah.
talking that sick where you're not standing up.
Yeah.
You can do it in a chair.
You could. That's what I was saying. You could do the chair in the tub. You could do it that way, and that way you can just reach over and switch. And you do it. You know, obviously, if you're really sick, do it as some people they do it. You know, twice. You don't have to do it the full 3, but as often as you endure as long as you can, the better, so that the treatment.
And like Wayne can handle way hotter and way colder than me. I am warm and cool. Warm and cool. That's what he would think of my hot and cold. He would say, This is warm and cool. But, you know, people are different,
Yeah.
and you have to do what's best for you.
Yeah.
You can't be the one to push someone else. You have to do what's
We gotta drag them.
right for you. So if
I
you,
do that too, when I get home, when I get a workout, when I'm snow blowing my driveway 850 feet, like today, I go and I stand in the shower for about 3, 4, 5, 6 minutes, and then as hot as possible. Then I just turn the cold one on and I just feel it, oh man, it's the
Yeah.
best. You feel the relief, the pain.
and if you get
Yeah.
hot enough, that
Work.
it feels good, doesn't it?
Oh, hot.
Yeah. If you get really
A
hot,
little
it
more,
feels
little more,
good.
then my skin is coming up.
I'm not that hot. Yeah.
No, but I like it, it's me away now.
What about
Yeah.
doing an Epsom salt bath only? Would that be relief like for muscle aches or something?
I've done it.
You can, yeah, it does. We did that mostly for some few of the patients that had like addictions, like alcoholism or drug addiction. It's really to have a neutral bath. You know, it's calming, and it helps them kind of get the toxins out of their system out.
So that's not only for
After a
aches.
sauna, they would do that. Yeah.
That's not only for aches, it's also for.
I've done it.
Yeah.
Being tired, everything, I've done it. I don't know.
So the majority of the patients that come to Eden Valley, I mean, do most of them have like cancer, or is it?
Most, I would say 99%, like I said, of the guests that are there, they call them guests, they have, usually it's around 3 to 4 stage cancer. Yeah,
Do they treat any kind of like blood cancers? Like,
all cancer, like name it, yep.
So
And-
he was showing us, sorry, were you going?
Oh,
I'm sorry, I didn't want to
no, no.
So he was showing us the infrared sauna thing that you can get online.
Yeah,
So,
we use that there as well, because when there was really busy, like when they had like a large number of patients that came in, they couldn't obviously fit everyone in there at the same time because there were people coming in and out because you have to be there. But they had the infrared sauna, not the one that Tammy was showing. They had the one with your head sticking out, so they would have that
It's
infrared
a
one.
sit-down little
Yeah.
one.
And
And it's not
yes.
as expensive as the double one, so
Yeah.
it's cheaper.
Yeah,
so you mentioned that that's good for people that are addicted to drugs.
yes, because it's just detoxifying their system. It works well. And of course, there's a combo of other like herbal treatments and whatnot, but that's the main one because you want to get them detoxified first before you start doing like other treatments. Could be like hydrotherapy, water treatments, could be bariatric, whatever. They cater it, which is nice. Specifically, they do have a doctor on site who oversees obviously all the guests, and then he prescribes the treatments for every individual person. So, yep, definitely. Any other questions?
Doreen does.
I was going to say, when I had COVID really bad and a high fever and really congested, and my oxygen was running 89 or 90,
Yeah.
Ooh,
I
scary.
didn't want to go to the doctor.
Mm.
So I got out all this stuff to do, the hot cold fermentation on myself.
Mm-hmm.
And I just stayed wrapped in a wool blanket. I had the canner full of boiling water. I would take a heavy towel, stick it in and just twist it,
Yeah.
put it in a wool cloth, run back in and sit with that till it got cool, wrap the blanket, go back and do it again. I did it 3 times chest, 3 times back.
Yeah.
Then the ice cold between. And it did make a lot of difference. It's
Yeah.
kind of a pain. But when I was growing up, if we started to come down with any sickness or cold, the dining room wooden table became a treatment table.
Mm-hmm.
A thick pad came out on it. We laid on it. We got the hot cold fermentation back and chest,
Yeah.
cold on your forehead, and
Yeah.
it would break it out, and it would just prevent it from getting worse.
Well, that's the whole point of all this is when going to an establishment like that is that for the graduates, they go and then they can share this in their churches, and then the church members know how to do these treatments, and they can tell the people that they know, so it just spreads where you can do these treatments at home, you know, for basic stuff that you're running. Normally a person would run to go get some pills at Walgreens or whatnot for fever reducer and whatnot, decongestion, and which actually causes more side effects and whatnot. And these is all natural, organic, holistic type.
The hot
So.
cold shower is easy, and even when
Yeah.
the kids were little and they get crude,
Yeah.
you take them in the hot steam shower to hold them.
The only thing you want to do is when you pay attention, especially for the Russian steam bath, is usually for the first 6 minutes they go into this tonic effect state, which is basically like they have like a adrenaline rush, you know. So you're the blood, yes, and you want to make sure that they're not like hyperventilating or anything like that, and you want to calm them down. And obviously put the cold compresses on that. And then after that, probably like 10 minutes to the duration, they'll go into the sedative effect state where they'll just be calm, relaxed, and whatnot. So like, for instance, in the fever baths, when we did those, there was a classic one because we had to go through it ourselves twice. Let me tell you, the first time it was quite intense. But but when you did it, they had this like euphoric, almost like state that they're in during the first, I would say 5, close to 10 minutes. And they were like awake, they were just chatting and whatnot. And then it just kind of like quickly, like a switch, they went to the sedative state where they're just kind of like lying there. And then the hands, because they're under the hot water, they're just kind of like cramp up like this, which is normal. And we just, you're monitoring them and you talk with them. We would check their temperatures and their oxygen levels every 5 minutes and make sure, because we tried to get their temperature up to 105, but if they can get up to 104, great. And we hold that for 30 minutes. And then after that, we start the cooling down process where we put cold water like in the tub slowly so that they can slowly adjust and come out of that. But yeah. Any other question?
All right.
I guess
You
that's
want to
it.
close with prayer?
Yes. Dear Heavenly Father, thank you so much for everyone coming here today. It was such a blessing. And you're just so wonderful. Despite storms and whatnot, you gather your people here and let your message be told. And what a blessing that is. And I hope and pray that the hydrotherapy lessons that were taught here today, that this stays with the people here, and then that they share it with the people that they know and actually practice it themselves and try it out, Lord, and to see the power of your healing power, because all is done by you and not on our own. We praise you, Lord God, for the Alpha and Omega. In Jesus' precious name, amen.
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 Well, thank you again for coming.
So you didn't get one of those?
Thank you so much.
I'm going to dump this.
And here's
I'm gonna go to this
for
guy.
you. Uh-huh.